Dear doctors and students, I am Dr. Mansoor Ali, Professor, Government Homeopathy Medical College, Calicut, Kerala of South India. Today we will start a new series, Analyzing Symptoms and Selecting the Rubrics. This endeavor is to guide you to convert the patient's narrations about himself and his life situations into the language of the homeopathic repertory and materia medica. We usually come across a number of mental and physical symptoms while taking the case. Unfortunately, we tend to neglect those symptoms due to our ignorance in converting them into the right rubrics. As a result, we fail to bring much relief to the patient. Remember, during Hanuman's time, we had only 100 remedies. These medicines were reproved, and their materia medica was written by Hanuman and his disciples. In spite of the small number of drugs and their close intimacy with the details of the symptoms, they found it very difficult to practice without a repertory. Now we have more than 4,000 remedies. Every well-proved drug has got thousands of symptoms. And for a man of average intelligence, it is almost impossible to remember all the symptoms of all the drugs to establish a total comparison with the disease picture. In this context, a repertory becomes an essential tool in our practice. Symptoms play an important role in unfolding the true image of the sickness. But in practical experience, they are very difficult to obtain from the sick person and are also difficult to understand or interpret correctly. Nevertheless, without repertories, nobody could find out the similimum in chronic cases and acute cases of multiple symptoms. All repertories are to be updated periodically with the new provings and symptoms, including clinical symptoms. The failure of remedies selected through repertories are not because of the defect of the repertories, but because of the defect in case taking and construction of the totality. Hence, if a similimum is to be found out, the case taking should be perfect and the evaluation of the symptoms, analysis of symptoms, construction of totality, and finally the interpretation of symptoms and rubrics should be faultless. One of the main problems we encounter in practice is the conversion of the patient's symptoms into the proper language of the repertory. In order to overcome this problem, we should understand exactly the meaning of each rubric, sub-rubric with the cross-reference and remedies. The mental rubrics especially are very difficult to understand by the dictionary meaning alone. We should understand the correct meaning assigned to a particular rubric from the mouth of great teachers and by constant practice. The importance of this work comes here to bridge the void and to point towards the similimum. This work may be a glittering star in the firmament of homeopathic repertory, teaching and learning, and will definitely help the students and practitioners to scale greater heights and will help them to make homeopathy system to the pinnacles of glory. And many of the physicians who have never used the repertory or rarely used repertory complain about its elaborate and time-consuming nature. This work is aimed at helping the beginners in homeopathy practice as well as the students of homeopathy. And I request you to give your valuable reviews and suggestions or additions, if any, to this work. So this work that is based on the homeopathic repertories of Kent, Synthesis, Murphy and Complete Repertory. And why this video? This endeavor is to guide you to convert the patient's narrations about himself and his life situations into the language of the repertory or materia medica. So, translating symptoms into rubric. How to find out the appropriate rubrics during case taking itself. How to find out the appropriate rubrics during case taking itself. That is what we are going to discuss. Now, how to utilize the age? Remember, the medicines will be different for the same complaint in different age group. Medicines will be different for the same complaint in different age group. Now we'll discuss some rubrics that is related to the newborn complaints. For example, in the Murphy's repertory, bladder, pain, bladder, urine, retention of painful newborn infants in. Remember, the medicines for the retention of urine for the newborn, children and adult, they are entirely different. Another rubric, bladder, retention of urine, infants, newborn. Breathing, asphyxia, newborn infants. Children, there is a beautiful chapter in Murphy's repertory, children. Urine retention in infants, newborn. In the clinical chapter, asphyxia, newborn infant. Nose, snuffles, general, infants of newborn. For example, another rubric in synthesis repertory for the newborn complaints, skin discoloration, yellow, children, newborn. This is a rubric for the jaundice. The medicines for the jaundice in adult and children or newborn are entirely different. Now some rubrics related to the babies. After the newborn, then babies. For example, in the Murphy's repertory, abdomen, cramping pain, babies in. Abdomen, protrusion of abdomen, umbilicus, babies in with flatulence. Bladder, retention of urine, babies. Brain, stroke, apoplexy, babies in. Clinical, aphthous ulcers, children in, babies. Clinical, stroke, apoplexy, babies in. Then mind, jealousy, general, children between, when a new baby takes the attention of the family away. Hyoscyamus and Ignitia, these are the two important remedies in that case. Mouth, thrush mouth, babies in. Rectum, redness of anus, congestion, rash, fiery red in babies. Skin, dry skin, babies in. And in the chapter toxicity, food poisoning, artificial food aggravates, baby food aggravates. Urine, retention of urine, babies in. Stomach, appetite, ravenous, anemic babies. Abdomen, pain, babies, colic. Rectum, constipation, babies. And the general children complaints in delicate, puny, sickly, artificial baby food from. This type of hundreds of rubrics are available in modern repertories for babies. Now infant, rubrics related to the infants. Abdomen, inflammation, umbilicus, infants. Children, respiratory affections, infants in. Eye and inflammation, infants. Mind, crying children in babies. Nose, obstruction of children, nursing infants. Rectum, constipation, children. Rectum, diarrhea, children. Rectum, diarrhea, nursing after in infants. Skin, intertrigo, infants in. Rectum, fissure, infants. Nerves, convulsions, children in infants. Fever, children in infant. Lungs, pneumonia, infants. Abdomen, hernia, umbilicus. Generals, in the chapter generals, nursing children, ailments in. So, while you are looking through the rubrics in different repertories related to the babies, infants or children, remember the medicines are entirely different. Some rubrics for the adolescents, bladder, urination, involuntary, night, adolescents. The medicine for the nocturnal enuresis in adolescents, that may be different from that of the children or the adult. This rubric is available in synthesis repertory. For example, in the case of puberty, generalities, puberty, ailments in. External throat, goiter, puberty in. Calcarea, adatum, hydrastis, etc. are the main remedies. And the rubric related to the young people, head, hair, baldness in young people. Menopause, female menopause, generalities, heat, flushes, menopause during, for the menopausal hot flushes. And some rubrics related to the old people, respiration, asthmatic, old people. The medicine for the old people and for children or infant or newborn babies for the asthma, that's entirely different. Mind, memory, weakness of facts, recent fact for old people. Female, metrorrhagia, old women in. Eye, cataract, senile. Prostate gland enlargement, senile. So these are all some rubrics related to the old people. So different types of rubrics from newborn to old people. Remember, the medicines are entirely different. So that's the importance of age related rubrics. Now about sex. Same complaint in different sex, medicines will be different. Same complaint in different sex, medicines will be different. For example, the rubric boys, bladder, urination, involuntary, night, boys in, there's a rubric. head pain schoolgirls, then eye cataract woman in. So some rubrics related to the particular sex. Another example in the case of tinea cruris, male eruption thighs between, or the female eruptions thighs between. Just to go through that two rubrics, you can see the medicines are entirely different for the tinea cruris. Even though the complaint is same, depending upon the sex, the medicines are entirely different. Now, occupation. What's the importance of occupation in case taking and repertorization? Hundreds of beautiful rubrics are related to the occupation that is available in the mind and general chapter of different repertories. And the best rubrics related to the occupation is available in the Constitution chapter of Murphy's repertory than any other repertory. Just go through the Constitution chapter of the Murphy's repertory. You will get hundreds of rubrics related to the different occupations, both related to the mind and also to the generals and particulars. Generality stone cutters. That's a rubric related to the occupation and synthesis repertory. Generality is carrying on the head aggravates for the head load workers. Generals carrying on the back aggravates. Second for the carrying the weight on the back. So occupation. We can utilize the rubrics related to the occupation. Now, what is the relevance of the history of presenting complaint and how we can utilize the details of the history of presenting complaints for the selection of the rubric? The history of presenting complaint will give a clue towards the etiology. For example, the general's measles after. History of presenting complaint. The complaint started after the measles. Male swelling of the testis mumps from. The swelling of the testes started after the mumps. So, the history of presenting complaint will give a clue towards the etiology and we can utilize the rubrics related to this type of etiology. Then HPC will give you a clue towards the diagnosis and we can utilize the rubrics like generalities, paralysis, apoplectic. A patient with hypertension. Paralysis started after the cerebrovascular accident. So, diagnosis. And the nature of the disease, whether the disease is an acute nature, chronic or recurrent nature, and select the rubric appropriate for that. Rectum, constipation, chronic. Rectum, constipation, chronic. Throat inflammations, tonsils, recurrent. Eye inflammation, acute. This type of acute, recurrent or chronic complaints related rubrics are available in almost all the repertories. So, the history of presenting complaint will give a clue towards the nature of the disease, whether it is an acute disease or chronic disease or a recurrent complaint, and select the appropriate rubric. And the fourth point, the onset and progress of the disease, whether the disease is a sudden onset or a gradual onset, and related the rubric. Vertigo sudden, generalities paralysis gradual, the remedy is plumbum metallicum. And the fifth point from the history of presenting complaint that will give a clue towards the extension and alternation of the complaint. Generalities, paralysis extended upwards, downwards, etc. Generals, side symptoms of one, right then left or left then right. Nose obstruction alternating sides. Respiration asthmatic alternating with eruptions. So this type of alternations or extension you will get from the history of presenting complaint and select the most appropriate rubric related to that particular condition. Now, what about the past history of past illness? We have to inquire in detail about the past history of acute and chronic diseases. Medical history, including the history of vaccination, any surgery, any mechanical injury, any snake bite, any poisonous insect bite, any accident, removal of warts or mental shock, etc., etc., and convert them into appropriate rubric. In majority of the time, we will take the past history in detail, but we are not utilizing it for a prescription or for the rubric selection. Now, the past history that will give a clue towards the etiology. For example, respiration asthmatic eruptions after suppressed. Suppressed eruptions in the past history that ultimately lead to asthma. So you can select the rubric respiration asthmatic eruptions after suppressed. And the diagnosis, cardiac complaint and joint affections in a patient with a history of recurrent tonsillitis. The patient has Past history of recurrent tonsillitis followed by joint pain. Now the patient has some cardiac complaint. So what may be the diagnosis? Rheumatic fever. So you can take the rubric: chest inflammation, heart, endocardium, rheumatic. Chest inflammation, heart, endocardium, rheumatic. So the past history will give a clue towards the diagnosis and you can select the appropriate rubric. And the third one, the development of the disease. This is a concept mainly by the Kent. Surgically or mechanically corrected tissues in the past history could be considered as a presenting complaint in the concept they would have been present there if a surgical intervention has not been made. So examples of surgically treated symptoms like the hernia, fibroids, hemorrhoids, cataract, deformities, fistulae, tumor, etc. So take rubrics: throat inflammations, tonsils recurrent, or female tumors, fibroid, etc. as a presenting complaint, even though that particular tissue that is removed mechanically years back. So development of the disease. And the past history that also give a clue towards the miasm. For example, generality psychosis or generality syphilis or generality sora, like that. So for example, in the case the patient has recurrent asthmatic complaints in the past history, followed by some rheumatic complaints. So you have to take the rubric generality psychosis. Bronchial asthma, that comes under the miasm psychosis. So select the rubrics. In majority of the instances, we will get a lot of information from the past history, but we are not utilizing it for a better prescriptions. So you can utilize for these 4 points. For example, in the case of etiology, then diagnosis, development of the disease, and miasm. And followed by not well since. That is also some good rubrics are there. For example, the rubric convalescence with a good number of sub-rubrics are available in the synthesis and complete repertory. Same rubric is available in the clinical chapter of Murphy's repertory. So not well since. So utilize the rubric convalescence. In synthesis repertory general chapter, there is a good rubric history with a good number of useful sub-rubrics. So please go through the history rubric in synthesis repertory under the generals chapter. You will get n number of rubrics and sub-rubrics. In complete repertory also few rubrics that is related to the past history is given. Now what is the relevance of the personal history and how we can utilize the details of the personal history for a better rubric selection and prescription? For example, the developmental landmarks, related rubrics, delayed milestones, mild talk, slow learning to, or extremities walk, late learning to. Now the patient can talk and walk, but in the personal history, the developmental landmarks, the child was unable to talk during the proper time. So you can take the rubric mind, talk, slow learning to, or extremities walk, late learning to, even though the patient has complained about migraine or the back pain, whatever it may be now. And the natural conditions of the dwellings, chill exposure or tropical countries, that's a rubric, and respiration difficult mountains in. This type of rubrics are available. And the nature of occupation, for example, generality stone cutters, respiration asthmatic minus asthma from cold dust, rectum constipation sedentary habits from, for example in the case of IT professionals, rectum constipation sedentary habits from. Then in the rubrics, some rubrics related to the habits. For example, respiration asthmatic drunkards in, head pain tobacco smoking from, generals food alcohol aggravates, generalities tobacco aggravates, generals narcotics aggravates. So we can utilize the rubrics related to the habits. And some rubrics related to the marriage. Mind marriage, the idea of marriage seems unendurable. Genitalia female, sexual desire increased in widows. This type of marriage related rubrics are available in the mind and the male and female chapter of different repertories. Now what is the relevance of the family history? In majority times we will took the family history in detail, but we are not utilizing the family history for a better prescriptions. So the family history gives a clue to any predisposition to any type of illness and may highlight the specific concerns of the patient that may about certain diseases. So you have to ask about, are your parents alive or have they died? Are there any disease running through the family? In synthesis repertory general chapter, we will get a beautiful rubric with a good number of sub-rubrics, family history. So utilize the rubric family history in the generalities chapter of the synthesis repertory for a better prescription. Family history will give you a clue towards miasm. Then take the rubric psora, syphilis or psychosis. For example, in the family, different family members have asthma or rheumatic complaints, you can take the rubric psychosis. Or in the family history, the patient might have some migraine headache that is running among the family, then you can take the rubric generalities psora. Or if there is some Parkinson's disease or some type of autoimmune disorders in the family, you can take the rubric generalities syphilis. So utilize the family history. Now, what is the relevance of the treatment history? In majority of times, we will write it as the treated Ayurvedically, allopathically, homeopathically, surgically, etc. But we are not utilizing that treatment history for a better prescriptions. So the treatment history helps the physician to avoid the administration of medicines used earlier improperly. Some related rubrics in different repertories. Generalities irritability, when too much medicine has produced an oversensitive state and the medicines fail to act. Fever, changing paroxysm after homeopathic potencies, the remedy is sepia. This rubric is there even in cancer repertory. Chest inflammation of the lungs, abuse of aconite after. For a fever case, the physician repeatedly prescribed the aconite that may result in the pneumonia. So chest inflammation of the lungs, abuse of aconite after. So medicine, remedies and convalescence are important rubrics listed in general chapter of the synthesis repertory, which gives many useful sub-rubrics. Generalities medicine, generalities remedies and generalities convalescence. These are all some rubrics that we can utilize for the treatment history. In Murphy's repertory, there is a big chapter on toxicity. Represent a good number of useful rubrics and sub-rubrics related to the treatment history. So just go through the rubrics under the chapter toxicity in Murphy's repertory and also the rubrics medicines, remedies and convalescence in synthesis repertory. You will get n number of rubrics and sub-rubrics related to the treatment history. Now we will try to convert some interesting symptoms given by the patient into the language of the repertory. Mental symptoms, physical symptoms and particulars. So decoding the rubrics. I fear and suspect that I might get corona. Nowadays the patient has extreme fear. Even after getting a coryza or after a mild fever, the patient usually suspect that patients are afraid of corona. Now, which rubric you will take in this type of situations, in this type of epidemic diseases? This rubric is not only useful for the corona, but all type of epidemic diseases. The rubric fear disease of impending, contagious or epidemic disease for. This rubric is there in synthesis repertory, and mind fear infection of. This rubric is there even in cancer repertory. So this rubric is useful in almost all type of epidemic diseases. The patient has extreme fear of getting this type of contagious diseases. I lost my job due to corona. Nearly 35% of the populations, or especially that of the IT sector, lost their job due to corona. Now, how you will work out this condition? Ailments from job having lost his. Ailments from job having lost his. I am infected with corona. I will die from it. Even from a simple fever or a throat pain, the patient has a great fear that I am infected with the corona. I will die from it, even though not. The rubric, delusion, disease, incurable he has. Another rubric, delusion, dying he is. So this rubric may be useful in all type of any other diseases. The patient has severe fever. So fear, I am infected with the corona, I will die from it. Delusion, disease, incurable he has, or delusion, dying he is. Then intense fear and anxiety in throat during corona pandemic. Nowadays the patient has severe, extreme anxiety for a mild throat complaints. So you can take the rubric throat, anxiety and apprehension in throat. Anxiety and apprehension in throat. I sacrificed everything for my son. But now he doesn't take care of me at all. How you will convert this life situation into the language of the repertory. I am sacrificed everything for my son, but now he doesn't take care of me. The rubric, ailments from disappointed. Ailments from disappointed. I brought up my son with much hardship. I have a better status in this society, but my son married out of the caste or religion and is staying in a separate house. How you will work out this condition? I brought up my son with much hardship. I have a better status in the society, but my son married out of the caste or religion and is staying in a separate house. The rubric, ailments from honor wounded. Ailments from honor wounded. I silently suffered domestic violence in my husband's house. Now I have migraine. Now I have migraine. But in the past history, she silently suffered domestic violence in husband's house from in-laws or mother-in-law. Husband is staying away, staying abroad. So how you will work out? Now the patient has osteoarthrosis of the knee joint or migraine or ovarian cyst. That may be because of the suppression of the anger and grief. She didn't react to the mother-in-law or not disclosed the matter to the husband or her own parents. So ultimately that may develop results in the development of the ovarian cyst or migraine headache or the OA of the knee. So how you will convert this life situation into the language of the repertory? The rubric is ailments from indignation or indignation ailments from in cancer repertory. Complaints from suppressed grief and anger. I took all treatment but got no relief at all. I took so many modalities like allopathy, Ayurveda, homeopathy, but got no relief at all. So, which rubric will work out in this condition? The rubric, despair, recovery of. Despair, recovery of. I took all treatments but got no relief at all. Now I stopped the treatment itself. This condition is entirely different from the previous rubric. I took all treatments but got no relief at all. Now I stopped the treatment itself. So which rubric will work out in this case? The rubric is disgust. Despair after repeated failures and he will stop further effort. Despair after repeated failures and he will stop further effort. That's the meaning of rubric disgust. I believe that my religion, my political affiliation and my caste is only right. I won't agree or allow anything else. How you will work out this condition? I believe that my religion, my political affiliation or my caste is only right. I won't agree or allow anything else. The rubric, fanaticism. That rubric is available even in cancer repertory. Fanatic. A 12-year-old child watches pornographic film but doesn't do masturbation. He got addicted to it once he saw it in his father's phone. So what will be the diagnosis in this case? A 12-year-old child addicted to pornographic film but not doing the masturbation. He got addicted to it once he saw it in his father's phone. So what may be the diagnosis and what may be the related rubric in this condition? So the diagnosis is OCD, obsessive compulsive neurosis or obsessive compulsive disorder. She is not doing any masturbation but an obsession. So which are the rubrics for the OCD or OCN, obsessive compulsive neurosis? So the rubric in synthesis repertory, mind, thoughts, persistent. Same type of thoughts, persisting, obsession. In complete repertory there is a beautiful rubric, compulsive disorder. And another rubric, obsessive compulsive disorder in Murphy's repertory. Then another rubric in synthesis repertory, that is thoughts compelling. Thoughts compelling. So these are all rubric for the OCDs. So remember the previous case, that is not sexual related, but that is an obsession to see the pornography film again and again. So you can select this rubrics related to the OCD. Pet dog won't eat when the master is not at present. The dog wouldn't eat when the master is not present. So how will you work out this condition? Two rubrics are there in synthesis repertory. Stomach appetite wanting, owner absent when. Another rubric in the chapter mind, anorexia nervosa, owner absent when. These two rubrics are available in synthesis repertory. Body feels bloated up during menarche or menopause. That's a common complaint nowadays. The body feels bloated up during menarche or menopause. So how you will work out? And the most important remedy in this case is pulsarilla for menarche and also for the menopause. That's a common complaint among ladies. So the rubric dropsy, external dropsy, menstrual disorder during puberty or menopause. So generality is dropsy, external dropsy, menstrual disorders during puberty or menopause. Wants to commit suicide but is not courageous enough to. How you will work out that? Because of the hardship at home, the husband house, she wants to commit suicide but is not courageous enough to. The rubric, suicidal disposition, courage but lacks. Suicidal disposition lacks courage. Scold the service provider for not being called according to the correct order. She scolded the officer in the bank for not calling according to the correct order. So in that case, which rubric you will work out? And this type of patients are very much worried while placing in a queue. The rubric, impatience. Impatience. So look at this picture on the left side and right side. Which rubric you will work out for the left person and which rubric you will work out for the right-sided personality? For the right-sided person, despite his disabilities, he is working hard. But on the left-sided person, he is begging despite his abilities. So the rubric for the right-sided person, that is ardent, enthusiastic, hard-working personality. That's ardent. And for the left-sided person, you can take the rubric either laziness. Because of his laziness, he is begging, not doing any work. Now, scold the staff for calling later than the appointment time given. Makes coughing sounds. In the OPD of our college or in our clinic or dispensary, the person is scolding the staff for calling later than the appointment time given and is making noises by coughing or pulling the chairs. So in this situation, which rubric you will work out? Again, the rubric is impatience. Impatience. A person who is dressed up well and combed his hair neatly demands that the others too should be neat like him. He is dressed well up, combed his hair neatly and demanding others should be neat like him. So which rubric you will work out in this context? Just think about it. The rubric is fastidious. Fastidious. Doctor, there are a lot of problems in my life. That doesn't matter. I am moving ahead with my life. Satisfied despite various problems or hurdles in my life. Doctor, there are a lot of problems in my life, but that doesn't matter. I am moving ahead with my life. Despite various problems or hurdles in the life, he is satisfied. So which rubric you will work out in this condition? The father has some disease or husband has some disease, still there is a pleasantness in her face. The rubric is content. Means satisfied despite various problems or hurdles in the life. Patient tells badly about the doctor who treated him before. Which rubric you will work out? Patient is talking badly about the doctor who treated him before. So in this type of personalities, you have to take the rubric abusive. Another rubric is slander disposition. These are all two rubrics related to this condition. Once he saw a snake and had got frightened. Now he gets scared even from seeing a picture of snake. Now he is staying in an apartment on the third or fifth floor, but still is afraid of snake. So once he saw a snake and had got frightened, now he gets scared even from seeing a picture of snake. So how you will work out this condition? Fear, fright, previous fright because of it. The mind chapter, there is a rubric: fear, fright, previous fright because of it. She is always engaged in the course of house and has no time to do anything else till the household work remain unfinished. How you will work out this condition? Always doing work, but the household works remain unfinished. She has no time for other work. So in this condition, which rubric will work out? The rubric is industrious, household affairs sins. The denotation of industrious means they are always working, but the net results are fruitless in many times. The net results are fruitless. Always doing some type of work, but not finishing everything. So industrious, household affairs sin. Laugh out loudly even while visiting a dead person's house. Laughs out loudly even while visiting a dead person's house. Can you give the rubric in this condition? Just think about it. Laughing serious matters over. Laughing serious matters over. That child finds pleasure in hurting other kids, animals at home. How you will work out? That particular child finds pleasure in hurting other kids or animals like the cat or the pet dog at home. The rubric: cruelty, inhumanity, suffer, loves to make people and animals. Loves to make people and animals suffers, cruelty and inhumanity. Tells about an event if it has happened just now, but in reality that would have happened long ago. Tells about an event as if it has happened just now, but in reality that would have happened long ago. The rubric in that case: confounding present with past. Confounding present with past. Parents were not caring him. He fell in love with a person who really loved and cared him. That is common in nuclear families. Parents were not caring him. He fell in love with a person who really loved and cared him. So the rubric in that case: forsaken feeling, beloved by his parents, wife, friends, feeling of not being. Another rubric: love, romantic love, desire for. Forsaken feeling means feeling of being left alone by his parents, wife, friends, and feeling of not being. Another rubric: love, romantic love, desire for. Whatever obstacles I face, I must reach a good position. Even if I fail, I will try again. Can you suggest a rubric for this condition? Whatever obstacles I face, I must reach a good position. Even if I fail, I will try again. There is a beautiful rubric in synthesis repertory: perseverance. Perseverance. Then I have a wish that I must reach at the top. This rubric is entirely different from that of the previous one. I have a wish that I must reach on the top. Ambition increased. Mind, ambition increased. But it's a higher degree, that is perseverance. He will reach that position despite various problems and hurdles. That's a condition of perseverance. But ambition is increased means I have a wish and that I must reach on the top. As I am looking too old, I am using more makeup. How you will work out? I am looking too old. That's why I am using too much makeup. Two rubrics are there: fear, old of getting, then fear, age of one's own. Fear, old of getting, and fear, age of one's own. Cries even at silly matters. How you will work out this condition? Cries even at silly matters. Two rubrics are there related to it. Weeping trifles at on trivial things, and admonition aggravates. That means the gentle advice aggravates. She doesn't like advice at all, gets angry from it, especially from the parents or from teachers. She doesn't like to get advice. She gets angry from it. Which rubric will work out? Admonition aggravates. Admonition aggravates. So look at this picture. Husband complained why his wife was not losing weight even after going to the gym for 3 months. So the manager sent him this picture. Can you give a rubric for this condition? The manager sent him this picture. She is not doing any exercise, simply talking with others. So the rubric in this case, gossiping. Gossiping is a rubric available in synthesis and complete repertory. Dream snake before menses. Dreams of snake before menses. That can be interpreted as sexual desire increased menses before. Probably because of the increased sexual desire, she is getting the dreams of menses. Sexual desire increased menses before, or sexual desire suppressed ailments from. These are the two related conditions we can interpret in this case. Father is afraid and hesitant to walk after he slipped and fell down once. The father is very much afraid to walk. Once he slipped and fell down earlier. So the rubric in that case, fear, fright, previous fright because of fear. And second rubric, fear walking. So the first rubric, because of previous fright from the fall, he is very much afraid of walking again. And the second rubric, fear walking. The patient is afraid that the doctor might give only fewer medicines if he tells the doctor that he is better. And some of the patients, they are always complaining about their disease to get a good quality medicines or a large quantity of medicines. So the patient is afraid that doctor might give only fewer medicines or minimum dose if he tells the doctor that he is better. You can take the rubric as thought strange, a related rubric in this case, thoughts strange. I am not loved by anybody. I am not loved by anybody. My colleagues get a boyfriend and girlfriend, but I am not loved by anybody. The rubric delusion, unfit, loved to be. Delusion, unfit, loved to be. Don't know whether it is because I am a girl. I am given less freedom compared to my brother. I am not even allowed to wear jeans pants. I am not even allowed to wear jean pants. How you will work out? Some type of overprotection for girls or even for the boys. I am given less freedom compared to my brother or compared to my neighbor or friend. I am not even allowed to wear jean pants. Two rubrics are there related to it. Mind ailments from parental protection excessive. That is available in synthesis repertory. And the second rubric, ailments from neglected being. Ailments from parental protection excessive and ailments from neglected being. Because of the excessive parental protection, the child is spoiled. The child has spoiled his life. He behaves badly to his parents, but behaves well to others. He behaves badly to his parents, but behaves well to the neighbors and friends. How you will work out? This is a common complaint by the parents. He is very harsh and abusive at home, but very friendly towards his parents and pleasant too. Friendly and pleasant to the neighbors or friends. So the rubric, abusive children insulting parents. That is one rubric. Mind abusive children insulting parents, and the second rubric that is related, that is a malicious children. Malicious children. Teachers and students have good opinion about him, but he behaves badly at home. Teachers and the other students have good opinion about him, but he behaves badly at home. That is another complaint commonly by the parents. So there is a beautiful rubric in the synthesis repertory, behavioral problems. Children in home but good at school with the strangers. He is very good at school and with the strangers, but behavioral problems at home. That's a rubric. It's a good rubric for this condition. Teachers and students have good opinion about him, even the friends, but he behaves badly at home. He is so good at daytime, but cries in and is very obstinate at night. The child or the baby is good at daytime, no problem, but cries and obstinate at night. The rubric, mind weeping, sleeping. Child good during the day, but screams and restless at night. Jalapa is the most important remedy, followed by Sorinum. Child is good during the day, but screams and restless at night. I dreamt my grandmother giving advice regarding my business. I followed the same and attained success. I followed the same and attained success. Can you give a rubric for this condition? I dreamt my grandmother's giving advice regarding my business during sleep. And I followed the same and attained success. Dreams, clairvoyance. Dreams, clairvoyance. That's a rubric in that situation. My husband is neither concerned about the house nor the kids. He is not at all taking care of them. Husband is not concerned about the home and not the kids. The rubric in that case, that is improvident. Not taking care of the home or the children or the wife. Improvident. My husband is not at all concerned about saving money and he gives everything to whoever asks him. We do not have much saving either. Even though we do not have much savings, husband is not at all concerned about saving money for the house, for the children, but he gives everything to whoever asks him. There are three conditions related to that. One may be extravagance, spending wastely, then squandering money, wasting money, and benevolence. That means a tendency to do charitable and generous act. So you can select either of this one rubric from out of these three, whether it is in extravagance, spending aimlessly or too much spending, that is extravagance, and squandering money, that means wasting money. But benevolence means he is helping others, tendency to do charitable and generous act, even though he do not have much saving. So you can select either of these three rubric. I feel that I have lost my ability to think. I am unable to think because of some hard work or because of some mental relaxation. Mental relaxation aggravates or impossible. The rubric mental relaxation aggravates or mental relaxation impossible. Another sub-rubric is there. So the rubric arguing with a woman is like reading the software license agreement. Go through the software license agreement of any company. So many paragraphs. In the end, you ignore everything and click I agree. So can you give a rubric related to this condition, this particular picture or situation? Arguing with a woman is like reading the software agreement. You have to read a lot, but in the end, you ignore everything and click I agree. The rubric arguing, that rubric is available in synthesis and complete repertory also. Arguing. Whenever I look, I find worms, even in my dreams, plates, water, etc. Everywhere worms are there. Two rubrics related, mind, fear, worms, and dreams, worms. Whenever I look and find worms, even in my dreams, plates or water, etc., even in water tap also. Two rubrics related, fear worms or dreams of worms. I still feel guilty for having done like that. I still feel guilty for having done like that. Can you give a rubric for that condition? The rubric is remorse. Remorse. Doctor, my disease will never get cured. Doctor, my disease will never get cured. There are three related rubrics are there. Fear, recovery. In the chapter mind, fear, recovery, he will not. Then another rubric, fixed ideas. Because of some fixed ideas, he might have thinking about like this. My disease is an incurable one. And thoughts persistent, type of obsession. My disease is an incurable one. I have much relief to my disease, maybe because I stopped smoking, not from the medicine from you or not from the medicine of the doctor. He is not satisfied with your treatment, but he stopped smoking and that may be the reason he got some relief to the complaint. This type of argument means the patient is not satisfied with your treatment. The rubric is discontent. Discontent means always dissatisfied. Lack of erection due to absence of sexual attraction towards the wife. Lack of erection due to absence of sexual attraction towards wife. Means erection wanting indifference with the sexual. Erection wanting indifference with the sexual. So lack of erection due to absence of sexual attraction. Lack of erection due to absence of sexual attraction towards his wife, but has no problem with other woman. How you will work out that condition? This rubric is even there in cancer repertory. He has no problem with the other woman, but lack of erection due to absence of sexual attraction towards his own wife. Erection wanting wife with. With others he has no problem. Erection wanting wife with. Husband came home after a long period. After 2 to 3 years or 1 or 2 years. Now there is a failure of erection due to lack of sexual life for a long period. How you will work out that condition? Husband is staying abroad for a job. Now he came back after a long period. Now there is a failure of erection due to lack of sexual life for a long period. So the rubric in that case, erection wanting continence from. Continence from, that is the rubric. Another rubric is celibacy. Celibacy from. Erection wanting celibacy from, or the best rubric, erection wanting continence from. The most important remedy in that case is conium maculatum. Hormone levels were found to be low during investigation as a part of infertility treatment. As a part of infertility treatment, he took the investigations, but hormone levels are found to be low. Can you give some related rubrics in this case? We can take in the chapter male or female atrophy. And there is a beautiful rubric in complete repertory, clinical hormonal hypofunction. The chapter clinical rubric hormonal hypofunction, that is there in complete repertory. Or you can take from the cancer repertory or synthesis repertory, male or female chapter atrophy. Lack of hormone, lack of low means low levels of hormone. Say he won't believe his wife. He won't believe his wife. So that may be delusion. Delusion, wife faithless, wife is. Mind delusion, wife run away from him. Wife will run away from him. These are two rubrics related. He won't believe his wife. Highly tensed about small health issues. Highly tensed about small health issues. This type of personalities are nowadays very common. So which rubric will work out? Highly tensed about small health issues. Even though he might have a small fever or a slight coryza, he is very much afraid that he might have some serious disease. Anxiety, health about. Anxiety, health about. Always find fault with others, even if something is done the best way. This type of personality, they are always finding fault with others, fault finding nature. Even if something, that is everything is done in the best way by the husband or the wife or by the colleagues or by the subordinate staff. So the rubric, censorious. Another rubric is fault finding. Censorious means critical or fault finding nature. So these are the two rubrics related to that condition. Always finding fault with others. My neighbor has all facilities. God didn't give me anything. My neighbor has all facilities, but God didn't give me anything. So the rubric in this case, which rubric will work out? The rubric is jealousy. Jealousy is the rubric. My neighbor has all facilities and is well settled. God didn't give me anything, but I will strive hard to become like him. My neighbor has all facilities. I will also try to achieve his prosperity. The rubric is envy. So the basic difference between envy and jealousy, Envy is positive, trying to attain the prosperity of others, but jealousy means the prosperity of others intolerable. So that's the main difference between envy and jealousy. So it is very difficult to study the mind rubrics with the help of a dictionary. The meaning may be same, but the interpretations and medicines are entirely different. He is told that all the tests are normal and he has no any disease. Still he doesn't get satisfied. He visits another doctor. In the previous case slide we discussed a rubric anxiety health about. That means for the small issues he is very much worried. But in this case almost all the investigations are normal. Still he is very much afraid and she is not satisfied with the doctor. He visits another doctor. So in this type of cases, which rubric you will work out? Just think about, because this type of conditions are very common in our day-to-day clinical practice. The rubric is hypochondriacs. So trying to differentiate between anxiety, health about and hypochondriac. In hypochondriac almost all the tests are normal. Still he is very much afraid. He does not take medicines at the right time, even though he knows that disease is a grave disease. He is not taking the medicines in proper time or in proper interval, discontinuing the treatment and again come after some time. He knows that his disease is something serious. So in this type of personality, which rubric you will work out? The rubric is indifference. Indifference. And pretending to suffer from some disease in order to get medicine from the dispensary or from the clinic. Pretending to be sick. How you will work out in this condition? The mother-in-law that pretending to be sick in order to avoid the work at home, or she wants to get the care of others, so that she is pretending. The rubric is feigning sick, pulsatilla and tarantula hispana. These are the two important remedies mentioned even in cancer repertory. Mind feigning sick, pretend to be sick in order to get some medicines from the doctor or to avoid working at home. Always think that he would become sick. Always thinking that he would become sick. The rubric delusion, sick to be. The most important remedy is calcarica. He should always have a feeling that I am a sick person. Staying away from his job, feeling and thinking that he is sick. There is a more specific rubric in that condition. Staying away from his job or not doing the work, feeling that and thinking that he is sick. The rubric again from the chapter delusion. Sick being, work, and for this reason he will not. He will not work because of the feeling of sickness. Delusion, sick being. This rubric in synthesis repertory. And for this reason he will not work. So try to select this type of specific rubric. You will definitely get 100% results. My wife opposes to whatever I say. She will give many reasons for that. My wife opposes to whatever I say. She will give many reasons for that. How you will work out that condition? Contradiction, disposition to. Contradiction, disposition to. And compare the another rubric. My wife opposes to whatever I say, even if she has no specific reason for that. In the previous case, she will give many reasons or the specific reason for that. But in the second case, she has no specific reason for that. She opposes everything, whatever I say. So in that case, you have to take the rubric contrary. Oppose anything and everything without applying the intellect or without any argument, proper argument. But in the previous case, she will oppose anything and everything, but by using the intellect with the argument. When I say something contradictory, my husband, he will leave the house. He is not reacting, he leaves the house. So in that case, the rubric is contradiction intolerant of. So they try to differentiate these three rubric. Contradiction, disposition to, that means she will give specific reason why I am opposing. In contrary, there is no specific reason. And contradiction, disposition to, she will leave or she will leave that particular situation or house in order to avoid the contradiction. Doctor, I have enough money to pay the consulting fee. Anyway, your fee is very high. I have enough money, but your fee is very high. So in that case, immediately take the rubric miserly. Miserly. type of personality. He wants to save money even when occasions that is considered necessary to spend. That's the meaning of miserly. Son and daughter-in-law shifted to rented house soon after their marriage. Which rubric you will work out for that particular son? Son and daughter-in-law shifted to a rented house immediately after their marriage. Selfish, that's a rubric. Because of their selfishness, they want their own life in a separate home, enjoying their life, not taking care of the parents. Selfish. Years have passed after she came here as a daughter-in-law. Still, she is not getting adjusted with anybody here. Even during the final BHMS period, she found it very difficult to adjust with the homeopathy teachings. Not satisfied with the homeopathy. Or in the family life, years have passed after she came here as a daughter-in-law. Still, she is not getting adjusted with anybody here. How you will work out this condition? Some type of adjustment problems are there in the first BHMS period, but ultimately they will become adjusted. But this type of personalities or students, they found it very difficult to adjust to the situation. So the rubric in that case, adaptability, loss of. Adaptability, loss of. Second rubric, discontent. Dissatisfied, always dissatisfied. So first rubric, adaptability, loss of, failure of adaptation to a situation even after years. And the second rubric, always dissatisfied. So which rubric you will work out for this condition? This may happen in some rich families. Dear rich people, if you can't feed your servant, please don't bring them to the restaurant. Please don't bring them to the restaurant. So can you give a rubric for this type of conditions, that feeling of that particular servant? What may be the feeling of that particular servant in this case? The rubric is neglected. Neglected. So we had discussed some interesting rubrics from our day-to-day clinical practice. Some situations, converted certain beautiful situations given by the patient in our clinic or in the OPD, and selected the most appropriate rubric. We will continue this discussion in the next video also. So we request you to give your valuable reviews and suggestions and additions. And you have to suggest some additions or maybe your requirement. You can WhatsApp me at 9249 337799. And don't forget to subscribe our channel for more videos like this. youtube.com/drmansurali, and the part 2 that will be available soon in the YouTube. So thank you for your patient listening. Please do visit our website homeobook.com. And that's all for the time being. Thank you.